discussing about the post-operative rehabilitation after the rotator cuff repair. The rotator cuff rehab is extremely important because the timing of start and progression of the therapy should align not only with the healing of the tissue but also we have to prevent the potential strain on the involved tissue. So that the successful treatment of the rotator cuff relies on the constant communication between the surgical and the rehabilitation staff. To achieve the ultimate goal of postoperative rehabilitation after rotator cuff repair, and that goal is to relieve pain, restore range of motion, and as well as restore the prior level of function of that shoulder. So, in the early phases of postoperative rehab, a sideline position with shoulder unweighted, we need to start the scapular neuromuscular education so that when we'll be starting rotator cuff strengthening at the later stage, the sound foundation of the scapular strength is already set in. So the early passive motion, which was started recently, so that to gain uh, a range of movement is actually is not very good, because if we start the range of motion early, there is a higher formation of the scar tissue, and that can cause stiffness and loss of motion. So a 2 weeks period of immobilization is extremely important so that there is the development of the type 1 collagen as a natural tissue which was present before the injury status. So the during passive elevation, if it is done in scapular plane of 30 degree, it causes a zero strain on the supraspinatus. But if the same elevation is done in the sagittal plane, that will causes the higher forces on the supraspinatus. So the proper way of doing physiotherapy is very important. Similarly, if the external rotation done from 0 to 60 degree in scapular causes the least strain on the repaired supraspinatus. Another thing is the shrug sign, where there is a superior migration of the humeral head, can reduce the subacromial space and causes impingement of the healed repaired rotator cuff. So this shrug sign actually indicates insufficient scapular muscles, rotator cuff, and alter biomechanics of the glenohumeral joint. So while doing the initial physiotherapy, the proper posture, proper scapular position is extremely important. So in the early stage of physiotherapy, we should start with the scapular retraction and downward rotation, and uh, that not only improve the scapular balance but also increases the subacromial space and help promote the healing environment. So in the intermediate stage, the goals of the rehabilitations are to achieve the full range of motion while adding basics and functional strengthening to combat the immobilization and deconditioning. Overactivation of upper trapezius and underactivation of middle or lower trapezius promotes poor scapular position. So the proper strengthening of all the three uh, scapular muscles, higher strap, middle strap, and lower strap are very important. The high serratus anterior activation has been reported in supine punch performed at 90 and 120 degree of the position like this. This can be started in the early phase of rehabilitation. While the middle trap activity occurs with the prone rowing or prone horizontal abduction in 90 degree. This can be started in the intermediate stage of the rehabilitation. While the greatest lower trapezius activity has been shown in the full prone full can exercise or sideline external rotation. The prone external rotation 90-degree abduction shows the highest level activation of infraspinatus, while the internal rotation in same 90-degree of abduction causes the highest activation of supraspinatus, infraspinatus, and subscapular, all the three muscles. So, what are the challenges after rotator cuff repair and starting the physiotherapy? So to make the repair successful and the rehab more difficult, these are smoking, diabetes, large massive rotator cuff tears, As per the Burkhardt et al. In 2003, the 80 to 95% improvement occurs if these three things are avoided. So the post-operative rehabilitation schedule, the phase one. Phase one usually started immediate post-operative and it starts 0 to 4 to 6 weeks post-operatively. In this phase, the patient has to wear the immobilizer. The pendulum exercises can be started. And what are the goals of the phase one? First, the patient education, control of the pain and inflammation, which is very important. Protect the repaired and healing tissue, early protected shoulder range of motion, and maintain the mobility of the joint surrounding the shoulder like elbow, wrist, and scapular stabilizers. So, what are the patient education? So, we have to make the patient aware how to use the swing. They should not attempt to lift with the operative arm like pushing, pulling, driving, and moving in the bed. Patient should not drive until surgeons allow. While sleeping, the sling should be worn, and patient can lie on one side, or if it is he is lying supine, he can use in a reclining chair or a propped up position. And a pillow can be put below the operated arm to support the shoulder. For the pain control, the icing or the cryotherapy can be started about 15-20 minutes every 1 hour when the patient is awake. And after this, the icing can be done 2 to 3 hours as needed. Pain medication has to be given at least a week or 10 days. And return to work in the early phase depends upon the type of the work the patient is doing. If the patient is doing light desk work and the dominant arm is involved, he can return to work between 3 to 6 weeks. But if the non-dominant arm is operated, he can return to work within 7 days of surgery. So, what are the exercises in the phase one, that is initial 4 to 6 weeks after the surgery? These are the neck exercises, wrist, hand range of movement, elbow, gentle elbow range of movement, and pendulum exercise. The pendulum exercise is very important, but that has to be done and lean forward. Let the operative arm dangle slowly so that all muscles around the shoulders are relaxed. Gently allow the arm to move by rocking body side to side, forward and back movement, and then make a semi small circular movement gently. Patient can also support the operative hand with the other arm while doing the exercise. Then the passive or assisted supine elevation and external rotation movement. For that, patient can either use another non-operated arm to do the supine elevation and external rotation, or the table slide in the forward bend position. Then the scapular squeeze exercises 5 to 10 seconds. He can hold it, release it, and this 10 to 15 repetition for 3 to 4 sets. This will help in strengthening the scapular stabilizers. So in the second stage of the post-operative rehabilitation, which usually start 4 to 6 weeks after the surgery to about 12 weeks, that is 3 months. And the goal of this uh, schedule is to start the progressive painful range of movement from passive ROM to active assisted ROM to active ROM. Improve the static and dynamic scapular control, continued protection of the repaired and healing tissue. This is very important. Let the patient do anything. We need to further protect the rotator cuff because it takes longer time to heal. Improve proprioception. Range of motion start at 4 to 6 weeks and last until 12 weeks post-operatively when patient gets complete pain-free range of motion. Patient education in the second stage, patient has to uh, he thought that he should avoid unassisted shoulder motion, that is reaching or sudden active abduction or sudden behind the back or across the body movement. This has to be avoided. Light activities such as eating, hygiene, reading, using the computer, this can be allowed. Patient can use a lightweight like cup of coffee, but he cannot use a bucket or something like that. Heat and ice. Initially, the patient can use a heating pad for 15-20 minutes before doing the exercise. That because that will loosen up the shoulder. And after the workout, he can do icing for 15 to 20 minutes. This will reduce the inflammation and relieve the pain. So return to work in the second phase is possible if the patient is doing the sedentary work without any lifting or using any heavy manual work. But the specific instruction or return to work plan for the heavier occupation patient or the laborer should be delayed. The patient can start or continue general fitness activities like walking, treadmills, stationary bikes, because this will keep the patient active and it will not stress the shoulder also. Using the sling or placing the hand on operative arm or in the pocket or jacket can be allowed because that will reduce the stress on the shoulder. So range of motion in second phase, the supine active assisted range of motion with the stick can be started. That stick can be used for the elevation as well as external rotation. Gradually progresses to the pain to range of motion from 120 to 150 degree. The progressive full ROM and begin to work into scapular plane at 6 to 8 weeks. Supine stick, supine towel, active range of motion, supine 45 degree recline, and standing. This schedule can be started step by step. Initially supine stick, then supine with a towel, then active range of motion in supine position, then in 45-degree recline position, and then in standing. The flexion stretch on the wall or the table can be started. That will start the isometric strengthening of the cup and the scapular muscle. Begin gentle end stage stretching at about 8 to 10 weeks. The pulley is an excellent tool, but that can be used very gently to increase the range of motion in flexion and in scapular plane. So the internal rotation can be started at about 6 to 8 weeks post-operatively. Initially, the supine internal rotation can be started with the patient lying and the arm slightly away from the body in the scapular plane, and patient can do a gentle internal rotation and then gentle external rotation. At about 8 weeks, he can begin across the body movement like cross body adduction, bring the operative arm across the chest. Strengthening exercises in early phase, that is from 4 to 8 weeks. These are like ball on the table. Start with the elbow bend at 90 degrees. Ensure the proper scapular positioning and lean forward slightly. And then facing the table, press the ball gradually and progress to the arm outstretched and in external rotation. Hydrotherapy in the intermediate stage. Hydrotherapy can be started. The patient can move into the pool and do a gentle active assisted abduction, external rotation without any jerk. Patient should not reach for the distant object. He should perform this within the arc of his motion, and this will not only improve the range of motion but also do the isometric exercises of the cuff and the scapular muscle, further strengthening the scapular stabilizers. The scar massage of the operative sites can also be done in this stage. The manual therapy, the soft tissue scar massage can be started. The cervical neck movement and the now once you get the full passive range of motion, a late phase of strengthening can be started. That will be after 8 to 10 weeks post-operatively. Then in this stage, the side lying external rotation, the arm supported on the towel with the elbow by the side, ensure the good scapular position, perform neutral and then progress to as rotation. Gentle wall press in the leaning position, scapular protraction and the retraction with the resistance. This can be started about 2 months post-operatively in the third phase of rehabilitation. Then use of the TheraBand yellow, start with the yellow, progress to green and then yellow in standing position. First do the rowing. While doing the rowing movement, your scapula should be stable and the arm, the shoulder should be in downward position and not in the shrugging position, and then pull gently and leave slowly. So this 10 to 15 repetition, 3-4 sets of rowing, then elbow range of motion using the TheraBand, and then the triceps exercises, and then external rotation and internal rotation to strengthen the subscap and infraspinatus can be started. The goal of the phase 3 are to achieve the full functional range of motion. The initial rotator cuff strengthening, improve the scapulohumeral rhythm, continued protection of the repaired and healed tissue. So what you should do to protect the rotator cuff repair as well as improve the range of motion. So patient has to avoid overhead lifting above the shoulder activities and lifting or pulling, pressing any object. Avoid quick movements like reaching to catch or falling object. The patient may begin to return to activities of daily living such as cooking, gardening, light cleaning, keeping in mind he should not reach to the far from object to avoid sudden abduction or sudden lifting heavy weight. The strengthening activities in the latter stage begin at about 12 weeks, that is, third 3 months post-operatively, and focus on gradually building the muscle strength and endurance. Begin about 2 to 3 sets of 10 and work up to 4 sets of 15. Begin with the light resistance band like yellow, then progress to green and blue. Registered shoulder strengthening can be started with a towel or ball supporting in 0 degree of abduction, and then gradually neutral to external rotation by side or in a sitting external rotation as with weight as tolerated. Alphabet with a band or a weight in supine with the arm in 90 degree of the flexion. Add slight scapular protraction and spell 3, 4, 5 alphabets in the air and repeat 10 times. Start with the lightweight or band or resistance around the back. The foam rolling on the wall, this can strengthen the scapular muscles as well as the rotator cuff and progress in gradually increasing range of motion as tolerated. Similarly, the ball on the wall exercise can be started. This not only improve the range of motion but also improve the endurance and strengthening of the cuff and the scapular muscle. Now in the late phase of strengthening, the flexion and caption with the weight with the light dumbbell lift arm with 30 degree 45 degree flexion. Repeat the caption plane, scapular plane. Resisted internal or external rotation at about 30 to 45 degree abduction. Progressive external rotation and internal rotation in abduction if the curve is strong in neutral position and patient able to maintain the good scapular control. The tennis ball or frisbee or plate with the frisbee upside down or the plate in the hand. Move the ball around the plate in circular motion without it touching the edges. Progress as tolerated. Increase the weight of the ball. Move the hand away from the body, and this will increase the strength in the healed rotator cuff. In now the last phase, that is the advanced strengthening phase, which usually started about 5 to 6 months after the surgery, and goal of this stage is specifically each patient depending upon their sports, work or recreational activities or the activities that patient is looking to return, whether he is returning to the contact sports or overhead sports. So depending upon that, the schedule can be specified. The activities with weight bearing need to be performed with caution as they can cause compression or aggravate the rotator cuff. When moving into weight bearing exercises, they should be progressed very gradually. Push up on the wall, then push up on the knees, push up with the knees bending. This can be started. The patient should discuss with their surgeon as to when it is appropriate to return to the gym routine, and it should not be before 6 months post-operative. It is recommended that heavy weights are not used. The lightweight with the more reputations are more beneficial. It is not recommended to perform the inclined bench press. Inclined bench should be avoided for about 8 to 9 months post-operatively. There should not be military press or deep or chin-up exercises. The long-term protection of the rotator cuff. Avoid lifting in a longer lever position, that is arm extended. Avoid heavy lifting overhead. It should be avoided. Incorporate rotator cuff strengthening exercises into the regular workout regime. So exercises. What are the exercises in the last stage of the repair, that is 5 to 6 months post-operative? These are push-up on the wall, push-up on the floor. Once on the floor, ensure patient only comes at 90-degree bend of the elbow and then come up. Advanced proprioceptive ball process starts with the two hands at the chest level and progress to one hand overhead. Planks can be done or push-ups with the Bosu ball. These are the further advancing exercises. The functional and sports specific drill unique to each patient and can include skills such as throwing, stick handling, or lifting mechanics. Exercises should be performed once per day with the exercise parameter focusing on developing the muscles, muscular endurance. The physiotherapist will be able to assist the patient with appropriate exercises prescription, and the surgeon will provide the guidance on timeline for return to operational and recreational activities. So, what are the inference from the schedule? That rehabilitation after rotator cuff repair must follow the criteria-based progression into taking into account healing of the repaired tissue. There should not be excessive stress on the repaired tissue, and the initial period of immobilization of 2 to 3 weeks is extremely important to prevent not only the strain on the tissue but also the formation of the scar tissue. With a firm understanding of the anatomy, healing properties, strain, and tissue loading, the program can be individualized to each patient. It is imperative for the patient to understand these guiding principles as well so that the realistic expectation can be established and desired outcome can be achieved in time. Return to sports or higher recreational activities depend upon how early patient gain the passive or active assisted range of motion, how the patient improve his strength and conditioning of the shoulder. Contact sports and the manual laborer must be informed regarding the precautions and complications. References. These are some of the references which are important in studying the effect of post-operative rehabilitation on the healing and the rotator cuff.